We had an interesting case recently of a subtle cause of nerve pain, which was causing this lady a significant amount of discomfort, but it had slipped under the radar from a diagnostic point of view. Most people, when they think about nerve pain, think of trapped nerves, either sciatica, if it's the lumbar spine, or nerve root irritation in the neck, causing pain in the arm. And they're by far and away the most frequent causes. But there are more subtle causes. The technical name of these are called entrapment neuropathies. And this particular case was of a lady who had an arterial catheter put into her wrist. She was in late stage pregnancy and had some other medical emergencies, and they had to get some medications into the artery for one, and they also wanted to put a camera up in to investigate. So there was a catheter placed in the wrist, and this caused some trauma around the blood vessels in the wrist, which caused a bleed. And eventually they had to abandon that procedure and then go in further up in the arm where the artery is bigger. And excuse me. So, and unfortunately, she had a bleed in that area too. And the problem is anatomically that the nerve and the blood vessel run side by side, usually in the limb. So if you have something that traumatizes the blood vessel and makes the blood leak, you develop bruising all around it, just as if you got a bang or a knock. So you'll see visible bruising. And this lady had some pictures of the first week or so when this happened, where there was a lot of bruising around the wrist and the inner arm. And what happens with that is that when the blood leaks from the blood vessels, it acts like an irritant to the nerve. So it causes nerve irritation, and it can also cause adhesions and stickiness in the tissues around it, so the nerve can't move as freely as it should do. So when this is unfortunately just a consequence of puncturing an artery, that sometimes they will bleed, and the point of entry just doesn't close over quickly, so you get some blood leakage. But obviously that's a very important thing to stop and arrest, because you can't sustain blood leaking from an artery for very long. So they tend to have to then put compression, strong compression around that area, and again, although that will stop the leakage of blood, it also compresses the nerve. But the medical priority is to stop the blood leakage. And as you know now, there's a big trend in using what is called minimally invasive approaches, particularly for heart surgery, getting stents in, and their stents are inserted through a tube that goes up into the artery. So all of the old procedures we used to see, what were called the coronary artery bypass grafts, where people would have their chest opened up with a sternotomy and opened apart, and then various kinds of grafts stitched into the heart. Stents now replace all of that, and the stent used to have to go in from the larger arteries in the legs, so typically in the upper groin. But now, with the evolution of technological improvements, they can go in through the arm, which is obviously much closer to the area. But nonetheless, depending on, regardless of which route is used, there is always the possibility of a bleed. The problem usually is, as with a lot of nerve pain, that very often the standard tests for nerve pain don't display any specific deficits. So often people will describe intermittent heaviness, strange sensations in the arm, sometimes feeling like it's swollen but not being swollen, shooting, stabbing pains, severe fatigue, which then recovers if they rest overnight. So when they're tested, very often the tests appear normal, the scans appear normal. The other kind of test that's often done is a nerve conduction test, which is a test to examine if there's much compression on the nerve. And in this situation, we're talking about a nerve being sensitive rather than necessarily being compressed. So nerve conduction studies are usually normal. And unfortunately, this combination of situations where the clinical, the investigations don't really shed much light on it, really then comes down to proper clinical testing. And there are very easy ways to determine whether the nerve is abnormally sensitive or not. There are a number of tests that we can do where you apply pressure along the nerve to determine whether it's sensitive. You can do movement tests, which get the nerve to move, and if it's sensitive to that, you know that it's abnormal in its response. And then the challenge treatment wise is to devise treatment techniques which regain the movement of the nerve so that it's not sensitive to movement as it has become. And also to try to do that in a way that doesn't provoke it. So sometimes in the case that we're talking about, if there has been bleeding into the tissues around the nerve, then very often those tissues get stuck and tight, and therefore when people move their arms, the nerve doesn't have the freedom to move because it's stuck to the tissues beside it. So the treatment approach for this is to try to move the tissues around the nerve to try and get them to be more elastic and more compliant. So that needs deep tissue work, gentle stretching, and obviously the concern here is not to be too aggressive to the sensitive nerve, which is in the middle of all of these tissues. So it can be a little bit of a challenge. And then of course to try to use movements which gently move the nerve. Some people think of it as stretching, but it's not really stretching. We're trying to get the nerve to move and become less sensitive to movement, because normally if a nerve is healthy and hasn't become sensitive, it doesn't react to movement. I often will use the analogy that it's like a sensitive tooth that might react to ice cream or hot tea, and sensitive nerves in the limbs can react abnormally to movements which wouldn't normally be provocative. So they're important things to try to incorporate into rehabilitation. Again, can be frustrating because it's a clinical diagnosis based on the symptoms that people describe and some specific testing procedures, but there aren't usually objective measures that one can validate by in terms of testing or blood tests or imaging of various sorts. Not uncommon, and again, even just people who are not necessarily having an artery explored, but even just simply giving blood. Used to be an old joke when the new house officers came on the wards. Very often you'd see people with quite diffuse bruising around the limbs because they hadn't quite learned the skill of refining taking blood without causing lots of bleeding. But this is one of the sort of the hidden side effects, and people often think it's a bit trivial, but if the nerve becomes particularly sensitive, one of the downsides of nerves is that it has a potential to become persistently sore, which is different to the other kind of tissues. So we're always a bit concerned when we see nerve sensitivity as part of a general pain pattern, because we do know that a small proportion of those people can become chronic and the symptoms just don't resolve. But in the vast majority of patients, you can achieve significant improvement. So an interesting case there, and a less commonly recognized cause of nerve pain, but nonetheless, we certainly see these cases. Hope you found that interesting. I'll see you again in another video. Bye for now.